Welcome to our webinar tonight on forgiveness. I'm Alan Pedersen, the Executive Director of the Compassionate Friends, and we are the largest grief organization in the world, helping families who are going through the death of a child, a grandchild, or a sibling. We have over 700 chapters around the country, and you can find us at compassionatefriends.org. And my co-host tonight is Dr. Gloria Horsley, and she, of course, is the president of the Open to Hope Foundation, and they are an amazing organization offering grief resources for loss of all types. They are our partners in our program tonight, and we've got a very special guest tonight that I want to tell you about. But first of all, welcome, Dr. Gloria. It's an honor to be here with you once again tonight.
Thanks. It's great to be on, especially when we've got one of the leading forgiveness experts in the world on. It's fabulous.
Yeah, we're loaded with information tonight, and I know we wanted to take off and get going, but Dr. Robert Enright, Dr. Bob Enright is with us, and he's a professor of educational psychology at the University of Wisconsin in Madison, but he's also a founding board member of the International Forgiveness Institute, and he has written over 100 publications, including 7 books on forgiveness, and forgiveness is a big topic for families grieving the death of a child. So we want to welcome him right on in and get started. Doctor, I guess we can call you Dr. Bob. You said that's okay. So Dr. Bob Enright, welcome to our webinar tonight.
Thank you so much, Ellen, and thank you, Gloria. It's an honor to be with you. Now, what I'd like to do I start now?
No, go right ahead.
Okay. Here's what we're going to do tonight, everybody. We're going to have 3 themes. We're going to learn what forgiveness is and what it's not. The not is important because some people confuse forgiveness with things that aren't forgiveness. And then we're going to talk briefly about the benefits of forgiving others who have hurt you. And then we'll look at the pathway of forgiveness that my colleagues and I at the University of Wisconsin have spent 3 decades examining, and we'll help you understand what that pathway is. I'd like you to understand that, first of all, forgiveness is your choice, and you should never be forced into forgiving. When people say, oh, just forgive that, or you'll feel better if you forgive. What's the matter with you? You haven't forgiven yet. Don't listen. Because I think the worst thing you can do with regard to forgiving is do it out of grim obligation because others want you to. It's got to come from within yourself. So that's something to keep in mind. Don't be pressured into it. And so let's take a look now at what forgiveness is. In the next slide, you're going to see that my mentor, if you will, is Aristotle from the 300 BC. And Aristotle told us that forgiveness is what we call a moral virtue, which starts within your heart as insight and flows out to other people for their good. If we take a look at the next slide, you'll see that forgiveness is something that definitely takes place across all of the world religions and the ancient philosophies that I, as an egghead professor, have been able to study. It cuts across what they call the 3 Abrahamic religions, Judaism, Christianity, and Islam. It cuts across Hinduism and Buddhism. It cuts across humanism and agnosticism and atheism, because it is a moral virtue. And all of us, regardless of our belief systems, regardless of our philosophies, quite frankly, want to be good people. And so with that in mind, let's now take a look at what forgiveness is and what it is not. This is important because I think the definition you see here cuts across all of the different ancient wisdom traditions that I just mentioned, including the new ones of humanism, for example. Let's take a look at this together. When we forgive, there are 3 components to the definition that I think the vast majority of people would agree with. First of all, you've been treated unjustly by a person or persons, and that could include yourself. When we forgive them, we try to get rid of something negative, which is resentment. Resentment can grow in our heart, and it can stay there for the rest of our lives unless we do something about it. And resentment, I have found, as a licensed psychologist, can kill people. It can actually rob you of your joy, rob you of your happiness. And it's a sinister little thing because it can take many decades to actually do a person in. That's what I do. Forgiveness is an antidote to resentment, and you strive to get rid of that. And then, because forgiveness is a moral virtue, take a look at this last bullet point. We actually strive for goodness of some kind to the one who has hurt us. That goodness can take the form of kindness or respect or patience or generosity or even love toward that person. And so the three-part definition, again, is we've been treated unjustly, we get rid of something negative, which is resentment, and we offer goodness of some kind to the one who hurt us. But forgiveness also is not a number of things. First of all, when you forgive, you do not condone or excuse. In other words, you don't say, oh, because I forgive you, what you did was not so bad. Or to ourselves, if we're forgiving ourselves, you don't say, okay, I didn't do such a bad thing because I'm forgiving myself. No, when you forgive, you always say what happened was wrong, is wrong, and will always be wrong. And you do not say, I am going to find an excuse so it's not so bad. You don't water down what happened. When you forgive, you don't forget. And I know people say, forgive and forget. And that's kind of a colloquialism, isn't it? But when we forgive, we do remember the hurts against us, but we remember in new ways. We don't remember with the resentment or the hatred or the sense of disruption and disorder and discontent. We remember in a calmer way, a more understanding way. Forgiveness is not just coming down or being indifferent toward the other or toward yourself or toward what happened. You're not indifferent when you are kind or patient or generous or respectful or loving, are you? You are not indifferent at all, because as a virtue, forgiveness is concerned about the other, about the one who hurt you. This next one is very important. When you forgive, you may or may not reconcile. And this is the most misunderstood part of forgiveness. People erroneously think that when they forgive, they must automatically enter into a relationship with the one who hurt them. You know, of course, you have to if you're self-forgiving, because you are living with yourself. But you don't necessarily reconcile with those who continue to hurt you, who continue to be abusive, who continue to be unjust to you despite your best efforts. You can forgive without reconciling. I want to repeat that because it's so important. You can forgive without reconciling. But the goal of forgiveness is to be open to reconciling with others. But the move they make is going to determine whether that happens. To put it in another kind of a context, when you forgive, you are exercising the moral virtue, like respect, like kindness, these are all moral virtues, toward someone who has not been kind to you. It starts within your heart and flows out to the other for good. Reconciliation is not a moral virtue. It's a negotiation strategy of two or more people coming back together again in mutual trust. And again, this next point, our final bullet point here, forgiveness is not abandoning the quest for fairness, or it's not giving up the moral virtue of justice.
Wow. You know what? I feel like almost this needs to be up on a wall or something, because I know with bereaved parents, I mean, they're really, one of the big things is you have to forget injustice. You have to excuse people. You have to be fair. I mean, that's all the things we think about forgiveness, isn't it?
Indeed it is, but you know what? That is going down a path that has nothing to do with forgiveness. And here's the tragedy of that. When we do that and give up on forgiveness by labeling it as something it's not, we don't have the path to get rid of the resentment. And that's what worries me when I care for other people, that when they say, oh, well, I'm going to have to give up justice and I'm going to have to automatically reconcile, then they're still bound up with that discontent and that discord and that division within themselves. And forgiveness can set us free from that if we can understand it correctly. That's the key. Okay? So now let's turn to some of the benefits of forgiveness, and then we'll turn to the pathway of how people forgive when they choose to do so and take some time for that. I am a professor, as Alan said, in educational psychology, and part of my task is to do scientific research. So if you turn to the next slide, you will see that we've done a number of studies, and these are just kind of a handful. And so let's go to the next slide that's a little more graphic here. And what you'll see is that we have, let's move back one to the Enright forgiveness research. Yeah, right here. You'll see we've done studies with incest survivors. Incest is a horrific injustice because a father figure who's supposed to protect instead violates. We've worked in drug rehabilitation, where people self-medicate because they've been so hurt by others or by themselves that they're trying to mask their resentment through drug or alcohol use. We've worked with terminally ill cancer patients who knew they were dying of cancer, and this was elderly who were literally on their deathbed, and they knew it because they were in hospice, and some of them are carrying around resentment for 40 years. And we worked on a forgiveness model that we'll see in a minute, and they ended up dying well. While their physical indicators were going down, they were becoming, believe it or not, more hopeful toward the future. Why? Because they knew in forgiving they were leaving their family in a better state. We've worked with students in 3 different cultures: the United States, Belfast, Northern Ireland, and Seoul, Korea. And we've helped them to learn to forgive, and their anger can go down, sometimes from clinical levels, even as adolescents or children, to non-clinically angry. We've worked with parents of students, where they have taught their students about forgiveness, and it's the parents who get even more out of it than the children. But let's go back to that incest survivor little block there on the far left. What we did is we worked, Suzanne Friedman actually did, one-on-one. She's a tenured professor at the University of Northern Iowa. And she worked for 1 hour a week for 14 months with 6 very courageous female incest survivors, and 6 were in a control group. And after the 14 months, the women who came to us clinically depressed became non-depressed. I want you to realize that not only did they improve in depression, the depression left. They went down in anxiety, and their self-esteem rose. A lot of times when we're really hurt by other people, we end up not liking ourselves. Then the control group started forgiveness therapy, and they too went from clinically depressed to non-depressed after 14 months with Susie Friedman. And what happened to the first group after their 14 months? Well, we waited another 14 months, and they were still clinically non-depressed. The forgiveness mattered to them, where they got their lives back. And you
now, one of the things that you have just told us is that you are going to start working with bereaved parents. And Alan and I are very excited about that, aren't we, Alan?
Yeah, absolutely. I think forgiveness is such a key aspect for ingredient rather for people who are grieving the death of a child or a grandchild or a sibling, that I think it's very interesting, the idea of studying it and what we can learn.
I agree.
Yeah, and we should say to people, if they're interested in this, when the show's finished, they can get in touch with us about possibly being in your study. So yeah, it works. So you know, we're excited about that. Let's get on to the next, so we can.
Okay. Well, let me just mention, since you mentioned that Lucy Martinsakova, who is from Slovakia, is doing a pioneering study, and so those people who are listening, who want to be part of this or know someone who wants to be part of this, can break new ground, beyond the incest survivors, beyond drug rehabilitation, where they will be able to have a chance to see the extent to which healing, emotional healing, can take place in bereavement when following a path of forgiveness. And here's
Bob, I've got a question right here from a woman. Her name's Jane. She says, I hear what the doctor is saying, and I agree, but it's not me that's angry, it's my husband. Can you give me some reasons? What can I say to him that will get him to want to go into that area?
Here's what I say all the time to people before they walk a forgiveness path. I want you to examine your inner world. And I want you to tell me on a 1 to 10 scale how you're doing in there in terms of emotional pain. And that's not unlike when we go to an emergency room and we blow out our knee in the gym, and there's that 1 to 10 scale. And people say, on a 1 to 10 scale, how sore is your knee? I want to know about the heart. And I think she should ask her husband, how are you doing on a 1 to 10 scale? 1 is, I'm joyous, I'm fine, and no problem. And 10 is, I almost can't stand it. It's so painful. Where is he on a 1 to 10 scale? If he's 5 or higher, he's a candidate for forgiveness. And here's what I would also say to him. If you're hurting emotionally because of unjust treatment from others, is there anything else you know of that's as effective or more effective than trying forgiveness? And if he sees that his pain is more controlling him than the other way around, I think he should do surgery of the heart. And forgiveness.
I like that, surgery of the heart. Yeah.
It's indeed what it is. It's surgery of the heart. Yes,
absolutely.
The emotional heart. Yes, indeed.
Yeah.
I think we're getting on to answering your question too with this next slide, how forgiveness can change your life physically.
Yep. And so if you take a look at that, especially the second quote here from Psychology Today, people who are able to forgive can actually modify their heart rate, lower their blood pressure, decrease physical pain, and even relieve their depression. Well, they got that last word, depression, from our studies, because we have shown also with the drug rehabilitation study that forgiveness has a way of reducing depression that no other psychotherapy in the world I know of can do. And so if you take a look at the next slide, you can see that forgiveness can also help us socially, in families, in communities. You see, one thing to keep in mind, and again, let me talk to the woman who's concerned about her husband, and I thank you for being concerned. When we have a broken heart, it's rarely isolated to ourselves. We tend to pass that kind of anger and discontent to others in the family, especially the children who absorb it, who take it, and then grow up. And they end up then themselves being discontented and giving that discontent to their children. And it can go literally for centuries. And I've seen that happen in Belfast, Northern Ireland, where I've been working for 14 years. There have been broken hearts there, passed on through the generations for hundreds of years. Something has to stop the broken hearts passed to others. Forgiveness can do that. So with that intro to how we forgive, let us now take a look at our pathway of how.
I've got one more question before you get into that pathway. It's from Rob, and he says, I have got a real problem. My wife actually talked me to coming in onto this show because I am angry with my son who overdosed.
Yeah.
And I don't know what to do with it. I feel terribly, terribly angry with him.
Yes, and see, that is not atypical, and my heart goes out to him. And my heart goes out to every one of the people listening, because there's a burden here on the heart that you did not ask for. And that's why forgiveness is both beautiful and controversial. Because as we're going to see in a minute, what forgiveness does is it takes our broken heart and through that pain gives goodness to the one who has hurt us. And Rob is going to see in a minute how he can begin the process of forgiving his son. I'm thoroughly convinced if he chooses to forgive, remember forgiveness is a choice, that he will be able to do this. It may be slow, it may be a challenge. Remember, the incest survivors took 14 months. But 14 months is a blink of an eye compared to how long they would have been living with resentment, which might have been the rest of their lives. And they were set free from that. So
that's a good point. Yeah, I've got one more question that you can kind of add in with that. And we just received it. I lost my adult son 2 years ago, June 14th. It's been 2 years. In an auto accident. He was a passenger. I'm having a very difficult time forgiving the driver for his reckless driving that resulted in my son's death. How do I get somewhere where I can forgive?
I think you're going to be able to see that fairly clearly in the next set of slides. So why don't we turn to that, and I will show you the pathway we've been working on for 3 decades at the University of Wisconsin-Madison. And it's a 4-step model. It's a process. And we have 4 different kind of guidelines, if you will. So here are the preliminaries. If you want to forgive someone who has hurt you deeply, I would first of all suggest that you listen to this pathway and not start with the deepest hurt, with the most challenging person. Instead, I would urge you to take someone who has hurt you more lightly, but still has upset your heart, and start practicing on that person. And so that you begin to learn the forgiveness steps. And here's another thing that I think is important that's not on this slide. Anyone who's going to be thinking about forgiveness should first think about how they are loved by at least one other person. Maybe it was your mother when you were 5 years old, when you slammed your finger into a door and she rocked you and she unconditionally loved you. Maybe it's a spouse, maybe it's a child or an uncle or a teacher. And try to understand that you have unconditional love that you can appropriate and call on to bolster your heart. And then with that in mind, we then look at the preliminaries. And again, don't start with the most difficult situation. Start practicing first and build up to that.
I mean, I think it could be even somebody, like I go to Starbucks every day and there's a woman who's really nasty. Yep. Maybe I can even look at these with her.
100%.
My own mind.
That's correct. And you could start this pathway and you will accomplish forgiveness quicker and deeper with her than you would if you pick the most thunderously negative, unjust issue with the most difficult person in your life. See, if you want to be physically fit, you don't start with a marathon. You start by walking around the block, then 2 sit-ups, and then you work up to an hour a day, and then you build up your muscles and your stamina, and then you can take it. I'm asking you to become forgivingly fit here. And that starts by slow steps, baby steps. And so let's pick someone else.
That's really, fascinating, because I think one of the issues, Bob, with forgiveness is sometimes it's just overwhelming to people.
Indeed.
The whole subject or the whole process, and this allows somebody to learn these steps. So that's fascinating.
Yeah,
I mean, we're just having a lot of questions come on. I think it's interesting just to look at them. I lost my adult son 2 years ago, 2014, in an automobile accident. Again, having trouble forgiving the one who did it. And then another person who said, again, terribly, my daughter passed away by suicide, was pushed by several individuals to cause her so much pain that leaving was easier than staying. She's been taking meds and for anxiety. And she had a lack of sleep, and she said, I blame the two of them. There is a war going on in my head for years. She's talking about years. She is angry about these people and feels that they caused her daughter to kill herself.
Notice the word war. That's right. And where is the war being fought? Internally, you see.
Yeah, it's amazing that she gets that. Yeah, that's in her head.
You have to understand that the war, for the most part, goes on inside us. Those who have hurt us usually don't even know they've hurt us. Some do not even care. Some are gone from our lives. And so we are left with an internal war. And forgiveness quiets that war. Forgiveness wins the war, right? So let's just look at these questions. Pick someone out, but knowing that you are loved and you're drawing on that love. Who hurt you? How deeply? On what specific incident will you focus? And again, let's not go to the big ones yet. What were the circumstances at the time? And kind of remember that. Cloudy day, sunny day, and the like. In other words, pick something out concretely and specifically. And I am doing the same as I talk with you. Now let's go to the first of our 4 phases in the next slide. And this is what we call uncovering your anger. When people say, I don't know if I should forgive, I don't know if I'm a good candidate for this, phase 1, the uncovering of your anger, is the diagnostic. I ask you a series of questions to see how hurting your heart is. Let's take a look. Have you avoided dealing with anger? Remember the drug rehab study? Most of the people there were actually right there where you see that question. They were trying to avoid the pain by self-medicating. They didn't get much farther than that, but it was killing them. They were in residential drug rehab, murdered, because it was such serious stuff, you see. And so when you break through that, you actually feel the pain, you're moving along. But the pain can be very tough. And so we ask on a 1 to 10 scale, have you faced your anger and how much anger do you have?
You know, wait a minute. There's a question here which I think is going to fit into here on what you're saying here. This person says, I don't feel the need to forgive my son for committing suicide. I am just heartbroken, but not angry with him. Just so sad I didn't protect him. Sounds to me like under that might be some anger at herself.
No, that's up to her to uncover gently, because again, that's going to be up to her. That's her call, what the answer is to that. And if the answer is no, she did her best, then she should not go towards self-forgiveness, because that would be overdoing it. But if she thinks that she has violated her own standard of how she dealt with it, then yes, it's good. And forgiveness, remember, is a safety net for you. You don't just open up that wound and say, oh my goodness, I did wrong, and there's no help or hope. No. There's a lot of help and hope, and it's called forgiveness. And so,
I love that. Here's another one who says, my daughter was a loving, forgiving person. I have asked Jesus to help me. It is just not happening. It is actually the opposite.
Well, you know why it's not happening for most people? Because they don't know how to forgive. You know how often I get the idea that people say, I want to forgive, I know I should forgive in my heart, but I don't know how to do it. That's what I've spent 30 years doing. And that's what our research is about, examining the pathway. And so this uncovering your anger starts with, are you denying anger? Are you open to how much anger you have? Do you have shame or guilt? And some of the questions are definitely saying yes. But sometimes it's from others because they whisper about you, or they whisper about the one you have lost. And they shine the light on you with condemnation, and that's an added burden. It's an added level of pain that you don't deserve. It's an added injustice. And then we also notice that when we live with the anger born out of injustice, it tends to affect our health generally. You know what the most frequent health complaint I get? Fatigue. People are tired because they're carrying a sack of woes on their back. Let's go to the next slide where we're continuing with the uncovering phase. Other kinds of issues we have are obsessing about the injury or the offender, where we have no peace.
Let's stop at that one, right? Because I've got something that fits in there. Someone just put, I forgive myself, and not the one or ones who may have hurt me. It's from Anne.
Yes, and so again, her choice is to say, the one who offended me most is myself. And not everyone's going to say that, because some will say, you know, I did the best I could, and others are telling me I didn't. See, then you have to fight against self-forgiveness, because sometimes it's false. We're harder on ourselves than we should be. So sometimes we have to see more clearly and say, you know, I think I've been so hard on myself, I'm over blaming myself. And then,
Well, she actually says that she forgives herself, but not the others who hurt her.
okay, well then that's her call. It's her choice. And forgiving herself then is the way to go. But not everyone will do that, is my point.
And then we've got one more. It says, my adult son died in a house fire 2 years ago. My husband, who is not my son's father, does not understand my grief and is even angry with me for not being over it yet. How can I possibly forgive my husband?
Stay tuned, because when the next couple of slides, you're going to get the insight. I think it's very important to stay tuned on that. So let's just finish up the uncovering and go to the meat of the matter. Let's just finish up some of the pain here. Sometimes there's a permanent change in your life. And of course, bereavement means we've lost someone and there is a permanent change. That itself is another added burden, an added pain, another part of the broken heart. And then finally, we see that when people are resentful, they oftentimes change their worldview and it becomes more negative, where they say no one can be trusted, or they're angry with God and they turn from the faith that they grew up with and had for years as a comfort. And so they end up blaming God for this. And so then they have fewer foundations upon which to rest, to find any kind of peace. And when you add all of these issues up from the last two slides, that's a ton of pain. And so the question becomes, what are you going to do with it? Which brings us into the next slide, which is phase 2. We're now starting to do the forgiveness work, and this is the decision phase. Has what you've tried to do in healing worked? Do you still need surgery of the heart? And if you do, then are you willing to practice forgiveness? And what will you be doing? Deliberately trying to get rid of the negative, which is resentment, and offering goodness of some kind to the one who hurt you. See how heroic forgiveness is? You are being good to those who haven't been good to you, including being good again to yourself if you have not been good to yourself. And when you decide to forgive, here's the first step. Okay, here's my first homework assignment. I'm a professor, I have to give homework. And so here is my homework assignment right here. Are you willing right now to commit to doing no harm to the one who hurt you? See, I'm not saying love them. I'm not even saying respect them or be kind or generous or any of that, any of the positives. I'm saying, are you willing to commit to refrain from the negative and do no harm? That would mean if you're forgiving yourself, that you will not harm yourself by a lifestyle that isn't healthy. Or with regard to others, you will not condemn them and revile them and drag them through the mud. Or if you're in contact with them, you will not seek subtle revenge against them. Are you willing to do no harm? If the answer is yes, even though we're just beginning the forgiveness process, you've come a long way.
Okay, now someone just said, what if the person you are forgiving is ongoingly awful?
If they're ongoingly awful, then you are not going to reconcile with that person. But that doesn't mean you are not going to do no harm, you see. Why would you want to do harm to those who are doing harm to you? You will bring justice along with forgiveness. So you will strive for fairness. You will ask something of that person. Sometimes people are so awful, they are breaking the law. They are harming you within the law. So you have to get the law on your side. But you are going to have forgiveness and justice. You may forgive and not reconcile, no matter how awful, as you say, that a person might be. You can still say, I will do no harm. I'm going to try and get rid of my resentment, which you'll see in a minute how we're going to do that. And you begin, and again, you will see that in a minute.
But you made a good point. If they're actually breaking the law, physically abusing you or whatever, you need to get help and get people involved with that. There's awful, and then there is beyond.
Forgiveness is tough-minded and tender-hearted. We can forgive with gentleness and hold them to the letter of the law through justice. Forgiveness and justice grow up side by side. It's very important that we remember that.
And the person who wrote that awful thing said that it was a family member, which it's hard when they're with you all the time.
That's right. And that's why from a forgiving heart, you can ask something of the person. And from a forgiving heart, what you will ask will probably be more reasonable than if you ask with a frothingly hateful heart, because then we'll ask for the pound of flesh, and that's not going to work. So let's take a look then at phase 3. Now we're getting into the work of forgiveness. Here's an exercise I want us all to engage in for just a minute. I want you to think about one person who's hurt you, about their past. I want you to see if there's any woundedness in that person's past, where they might be hurt themselves. They might be confused themselves. Remember, we recently had the comment that a child was hit in maybe, I don't know if it's hit and run, but it was in a car accident and someone else was at the wheel. I bet you that person who was at the wheel might have had very deep hurt heart, where the person just was taking the anger out on the road, engaging in reckless driving, not really almost caring. And if you look back on what that person's life is like, I bet you that person was living an extremely wounded life. And I'm not saying that to excuse. What I'm saying is this person might have been gravely wounded, and your child was a victim of that person's wounds. In other words, this person isn't evil incarnate who did this. This probably happened out of an exceedingly wounded heart. No one knew it, including the person who was doing the driving. And I think if that person was able to forgive, they would have been driving more civilly. But I want you to see the woundedness in the heart of the one who wounded you. Second, I want you to take a more global perspective rather than this personal wounded perspective. And I want you to see whether or not you think the one who you have in mind, who has wounded you, shares a common humanity with you. You both will die one day. You both need air to breathe. You both need nutrition and sleep and exercise. Your circulatory systems work in a similar way. You are equally human. What does that mean for you when you see that you have a very wounded person in front of you and a human being, a person just like you? Does your heart in any way change even a tiny bit? And then here's a cosmic perspective that the philosopher Keith Yandell, Y-A-N-D-E-L-L, told me to include in the process model. He said my perspectives were not largely visionary enough. He told me about the cosmic perspective, so I want to share that with others. Is there a transcendent spiritual part of this world? In other words, is there something or someone we could call God? And if so, is it possible that you two, both of you, you and the one who hurt you, are both made in the image and likeness of God? And if so, we now have a situation where you're both made in the image and likeness of God. You share a common personhood, and you share woundedness. And out of that person's wounds, they wounded you. You see someone who's different than before I asked those questions? And what of your heart? If you study your heart for a moment, is it softer a little bit? That's compassion. Even a little bit of softness is compassion growing in the heart. And when you forgive, you decide to do this. I will stand up and I will face this pain that has happened to me. And I'm not going to harm the person who harmed me. And I see if I can bear this pain and not throw it back onto that person. Then I'm not going to throw that pain onto anybody else, including my spouse or my children or my coworkers. Are you able to say, with my pain, I will stand and not give it to other people? And that's where people's self-esteem starts growing. They start liking themselves better. Their worldview gets sunnier, they're happier. It's at this point that you realize that you are stronger than the injustice that has come to visit you. When you can see the woundedness in others, the humanity in others, and how you share a transcendent nature, when you say, I will not give back pound for pound injustice for the injustice. I will stand in my pain. I will bear my pain. You realize you're stronger than you ever thought you were. This injustice has given you a chance to see that you are stronger than you ever thought.
Now we've got a note from a woman here who says, the problem is I have to see the boy who is driving the car grow up when my son is dead.
Yes, that's true. And that's very, very hard. And you know what? That's another layer of pain. That's another injustice. You see, the first injustice was the car accident itself. Now he is free. He is going to grow up. He's going to live a full life. And sadly, tragically, her son will not. You have to treat those as two different injustices and handle them one at a time. And so you don't forgive the person for all of this. You pick out one of these. And you walk this path of seeing the humanity in him, seeing his woundedness, seeing his confusion, seeing that he is passing pain along to others. And you know what? If he doesn't find a way to forgive others for his pain, even though he will grow up with torture inside of him. And that's not a very good way to live. He has to find a way out of that which killed another human being. And I am very worried for him and his humanity and his health and the way he will live his life unless he finds a way to forgive those who wounded him. And then finally,
we've got a tough one here for you, because John says there hasn't been anything said that makes me believe I didn't hate the person involved in my child's death. I would see a benefit to me or anyone else. And I'm not sure. I guess he meant I don't see a benefit to me. Well, John, I can tell you that grief can kill you, literally. It can ruin your health. It can ruin everyone else. You know, it can be, you know, it's just not good. It's not a way to live. It's letting other people take your life away from you, basically.
And so if you think about that, and Gloria, that's extremely well said. That's a beautiful statement. What happens now, you see, is a life was taken. And unless we find a way to deal with that, a second life will be taken. And that's those listening, you see. And we're not going to let that happen. Because unless we can do something about that grief, the person's going to claim another victim. I don't think we should do that. And then take a look at this last bullet point here. And here's where forgiveness shows the magnanimity, the graciousness, the giving nature of the moral virtue. You strive to give a gift to the one who hurt you. That's where it's controversial. People aren't ready for that when there's very deep grief, there's very deep anger with regard to the one who hurt you. But here's what I mean by giving a gift. You might be able to say a kind word about the person. You might be able to help them in some way. One of the incest survivors, upon forgiving, and she said she never would, by the way, at the beginning of the therapy, she helped care for her dying father in the hospital. And she said, I'm glad I did it, because I would have had grief and resentment mingled together. She said, now I just have grief, and the two would have been too difficult to take. Another woman in the incest survivor study that Suzanne Friedman did was Jewish, and she brought her children to the cemetery. Her father was deceased. And she did a tasteful Jewish ceremony of respect for the dead in front of her children, giving her father a good name in the family, not because of what he did, but in spite of that. And that took great courage and great strength, where she had to stand in the pain and not try to throw the pain back to the one who hurt her or to run away from that pain. And in doing so, that's when people begin to heal. And so, just to summarize the work phase, we begin to see that the other person shares woundedness, not from the same incident, but from a position of woundedness. They have wounded your loved one and you. You then work to understand that they're fully human, even though it might not appear that's the case, and that you share a common transcendence. If you have a belief system beyond the material, you may meet that person in heaven someday. How are you going to deal with that? Forgiving now may help that. And you begin to bear the pain, the heart softens, and you're able to give even the tiniest of gifts, even if it's a return phone call, or an email or a kind word about them if you're not in contact with them. Let's then go to the next slide where we talk about discovery and release. And here, once we've done the work of understanding the person, that can take months. I did it in 10 minutes. With the incest survivors, it took many months to really just think about the person in new ways, to train the mind and the heart to see more broadly, to increase the vision of who the person is. Once you do that work over months, you begin to discover that you have found meaning in what you've suffered. And what I mean by that is, a lot of times people say, you know, with regard to this path I have walked, I am now more sensitive to the wounds of other people. I now realize that when we dress in our finery and we all tip our teacups in just the right way, and we all say, oh, hello, we end up with a superficiality, you see. And nobody sees the broken heart of anybody else in society. But once you've suffered, you realize even though they're tipping their teacup in just the right way, in all likelihood, their heart is broken. And you're more attuned to that than you may ever have been. In other words, our suffering can give us eyes to see that many people cannot see. We're attuned to the suffering of others. We discover our need to be forgiven. If we forgive, maybe we've done something wrong. Maybe it's time for us to seek forgiveness from others, including ourselves. And we see that forgiving and seeking forgiveness are hand in glove. And we realize we're not alone. You're not alone today because Gloria and Alan have set this up so we could all share the burden of pain. We could all share a pathway of healing that is forgiveness. We're not alone in this. You're not alone. I stand with you. I am dedicating my career, actually, to helping you. I have decided 30 years ago to help take on the pain of others so that their pain can lessen. We oftentimes develop a new purpose in life, and that purpose is not only seeing the pain in others, but alleviating it. Suzanne and I were quite surprised because we were not ready for it when we discovered that the incest survivors, almost all of them, upon forgiving, wanted to become even informal helpers of other incest survivors, to bring them the pathway, to help them reduce their depression, to help them reduce their anxiety, to help them reduce their anger. And that gives a marvelous sense of well-being in your life if you have a goal. And if that goal is, there's enough pain in this world, I've had enough, I'm going to do my job to lessen the pain as best I can with the life that's left in me. And you can't wait to get up in the morning then when you have that kind of an end point that you may never have had before, you see. There's a lot of woundedness out there, and you are one of the walking wounded. But when you can heal, maybe you want to then go to the triage center of forgiveness and help people with their wounds. And it's at that point we see, and our science bears this out, that you then are no longer just a victim of what happened to you. You are someone who is a survivor. And one woman said to me a long time ago, who was a survivor of incest, she says, you have to add another word here. She said, I have become a thriver. And I like that. And she said, I am someone who can find meaning and purpose and being alive and even finding joy in my heart, because I know no matter what happens to me from now on, I will never be defeated by injustice because I have an antidote to it. I have a way, it's like an antibiotic for a very serious bacterial infection. And forgiveness is the antidote to resentment. They can now enter the world with a confidence and take more risks, trust more people, because even if hurt, they can bear that pain, and then move on in life rather than be crushed by that life.
So we have another comment from John. John says, you're talking about pretending what happened didn't happen. Yes, my old life is gone. Changing my perspective of my son's death will not change anything. Pretending it didn't happen is denial, John.
John is 100% correct that what he's talking about is denial and it's playing games. But you know where John is wrong? That's not forgiveness. And John, my heart goes out to you. And I think in your pain, you are distorting what forgiveness is. Let me share with you something very important. There are two waves of injustice that visit all of us when we have been crushed by life. The first wave is whatever happened to you, okay? The car accident, or an early death from suicide, or whatever it is. Let's call that the first wave of injustice. Tell me, John, what is the second wave of injustice that always and without exception comes to visit everyone who's been hurt in the first way I described? You know what that second wave is? It's resentment. Resentment is unfair. It's an injustice that now you and I and everyone else listening has inherited from the first wave. You are focusing on the first wave of injustice, and you're right. Forgiveness will not cure what happened. It will not stop the accident. It will not stop the suicide. But it will stop the second wave of injustice that has come to visit you, which is the resentment in your heart. And you have made a common mistake, John. You have focused on the first wave of injustice and say forgiveness is nothing because it won't touch that. I agree with you. Forgiveness will not touch that, but it is a cure for the second wave that nobody sees. And that's the tragedy that I think is part of the modern world and why I fight so hard for forgiveness, because I have seen that people do develop resentment, a second wave invariably when the first wave hits you, and forgiveness is a cure for that.
So we have another. Oh, go ahead.
Gloria, let me say something, because it's very profound what we're touching on here and what John just had to say.
Yeah.
And I think this is why we're very excited about this research for bereaved parents. Because what I find with a lot of people, and John may very well be in that same position, is that second wave that you talk about, which is anger, and you know, for a lot of people, it feels like grief to them. In other words, if I'm angry at the driver of that car, then that's grieving by putting my energy into that anger, and it keeps us from really working the grief process. And what we're learning today is that this forgiveness model is its own work, but when we do that, it really can help us with the grieving process. But I think a lot of people get stuck in that position to where they're misguiding that anger, and it's holding them back from moving through the grieving process. Do you agree with that, Gloria?
Yeah, I think that's a great point, Alan. And I think there's one thing that about bereaved parents too that we can't forget. It's a long-term process, and sometimes it takes a year or two for you to get into this kind of place. If you're coming on right now, your child killed themselves or was killed in an accident a month ago. This is pretty tough stuff. I say to people, sometimes fold it up or keep this webinar and bring it out a little later. So not everybody's ready. It's all different.
Exactly. Remember, I started the show here by saying forgiveness is a choice. John, if you're not ready to forgive, that honestly, I respect that. I would not expect you to start this path just because we've had this webinar. No. If you're not ready, I absolutely, if you need my permission, which I don't think you do, but I'm going to give it to you if it would help, then don't start the forgiveness process. But if you are stuck by saying, forgiveness isn't helping with this first wave of injustice that won't give me my child back or my loved one back, look at the second wave that invariably visits us all, the resentment. We can get rid of that. And as Alan so wonderfully just said, if we don't get rid of that, we can get stuck in the grieving process for the rest of our day. And now let's turn to the last slide that there's a couple more slides after this, but this is the last slide of a point I want to make, is what I call your forgiveness legacy. On this earth, I have come to realize that hatred and profound toxic anger are almost not really concrete entities, but they're like concrete entities in that they live after us. And so is love, so is goodness, so is caring. And you and I have a choice tonight, or whenever someone listens to this. Maybe it'll be a morning for them. When we die, we are going to leave something of ourselves, of our emotional selves on this earth. And it could be toxic anger, that our children, bewildered by it, will have to visit a webinar like this 20 years from now, because they have the discontent and the discord and the division in their heart that they inherited from us. Or we might be able, with our new meaning and purpose in life, to make a commitment to leaving more love in the world than there was before we were born. And the moves we make today will determine whether we're going to leave more love or more discord and discontent in this world. And I think forgiveness helps us leave more love in the world. I have been working in Belfast, Northern Ireland for 14 years, and I have seen what toxic anger can do. And it's very easy to leave a legacy of hatred, confusion, prejudice on this earth. And our children are so obedient, they absorb that. And then they leave it to their children, and on it goes. Someone, at some point in any family, must stop that kind of legacy and turn the family into the giving of love. And you might be that person. And forgiveness can help you get there. So my parting question to you is this: what are you going to decide to leave in this world? More harm, more hatred, more confusion, or more love? Forgiveness can help you leave the latter. I think that's a great way to live.
We just got a message from John. He said, thank you for addressing my comments.
Thank you, John, for giving me the opportunity to do so. You see, we're a team, you and I, even though it looked like we disagreed at the beginning.
Well, I think the number of questions tonight just reflects the fact that in the grieving process, I mean, this is a huge part of it. And Gloria can attest, both of us have done workshops on anger, and they are very difficult to do because people come in with anger and that they don't know what to do with it. And I think they do sometimes mistake that anger for grieving. It's part of grieving, but this is very good information tonight, Dr. Bob. Gloria, this is just a lot of information to digest in a quick period of time, but it's wonderful information.
Well, I'm just so excited about the study that's going to be done.
I was about to mention that. Let's not forget Lucy's study of bereaved parents. And I really do hope that they will get in touch with you, Gloria, because I'm going to leave Lucy's email information. And let's get started on this, because there's a lot of pain there that Lucy is willing to bind up and help people with. It's available. There is no cost to anybody. In fact, they even get a free book if they're going to be randomly assigned to one of two conditions. But in the second condition, if it's not forgiveness, they will get that later, okay? But those who start the forgiveness condition get a copy of my book, Forgiveness is a Choice. I hope they think that's good. They'll have to decide that for themselves, okay? But I poured my heart and my life into that book for hurting people. And that's going to be the treatment model right there for forgiveness. I can't tell you much about the other one. I'm going to let Lucy do that, but it's randomized to one or the other. But then those who are in the other group do get forgiveness later on.
Fabulous. We've got to take one more question. It's the last one I've got. But my son committed suicide. I did a ton of stuff for him. I hurt him deeply also. How do I forgive myself, Mike?
Okay, here's what you do, Mike, in my opinion. Don't start with forgiving yourself. Start first with forgiving others apart from your child who have hurt you, and practice this seeing in a wider vision the person as a true human being, perhaps depending on your faith or not, whether they're made in the image and likeness of God and whether they're wounded, and your gentleness toward them. And once you've walked the path of forgiving toward others and you've given them gentleness and understanding, then you apply that directly to yourself and what happened here. And as you learn to give gentleness and understanding to others, you will then do that to yourself. And that's when you begin to cut yourself a break, not because of what you've done, but in spite of it. You are more than those actions. And that gentleness will then become part of you. You will be emotionally healed, and you will have forgiven yourself.
Well, this webinar tonight has been terrific. And Dr. Bob, I hope this is not the end of a conversation, but the beginning of one that we will continue. You certainly have information that is valuable to the compassionate friends and to all of the Open to Hope folks, because we want to see people work through these issues of forgiveness so that they can find peace and can find healing when they're going through grief. So once again, thank you, Dr. Bob Enright, for being on the program. Dr. Gloria, it's been terrific.